Good afternoon, everybody.
Hello.
My name is journalist Mark. I'm here with two doctors. This is Dr. Lee, she's from Algeria, and this is Dr. Yenny, she's from Colombia. So today we're gonna talk a little bit about a universal hospital in Thailand, where many people, many tourists have been there. So now we have to know the truth from those two doctors because they've been traveling a lot. So we have to ask them some questions so that we can really know if what we've heard is true or not. Okay, this is Dr. Lee. I'm going to ask you some questions. Could you tell us a little bit about yourself?
Okay, I doctor for neurology doctor. I study here and I practice my medicine in India. So I recommended India for a good medicine, and that's it.
Okay, so what can you tell us about the hospital in India?
Okay, first I'm talking about the tourist medicals because I think it's very important because the countries riches don't more expensive than countries don't riches. Like India is a good example for this because has more cheaper, it's cheaper than countries like United States or other countries like this.
According to what I've heard, it's like a hotel, so people cannot really understand what's going on inside of that hospital. Could you tell us more?
Oh yeah, this is a good question. Indian hospital has a good website where the people, for example, United States, can find plans for operation, for hotel and food all together, and can pay for that for this. And usually, some person can pay for a month and can go.
Concerning the hotel, how much can you pay every day to stay there?
I don't know with a price exactly. For example, my grandmother had the operation in India, the knees. If the cost here is $30,000, so in India is $10,000. So you see the difference. So with the $20,000 left, you can pay hotel, cars, and food, and you get money, you save money. So I think it's better in India.
Okay, now we have Dr. Lee. We're going to ask her some questions. What do you think about what you just heard from her?
Actually, for me, the medical tourism I don't trust because first of all, we don't know the place that you go, is it safe or not, and the maintenance of the hospital, especially in India, like we know they have a lot of diseases, so if a patient travel over there, so he might come with a disease, and I don't trust the place over there because I don't know the maintenance and the food is it good or not. So, and to travel over there, you're gonna have the same money. You're not gonna save because you have to have a visa and you have to pay for tickets or wherever you're gonna travel with one of your relatives. So you're gonna pay more. And if you have a surgery over there, maybe the doctor will tell you he's gonna recommend to stay maybe 2-3 months, or it depends, whatever. So at that time, maybe you cannot stay over there. You have to travel back, or maybe if someone has children, they cannot stay that long in the country. And some other cases, it's emergency, you cannot travel. Maybe if someone have a heart attack, he cannot travel to India at this time to save some money. Maybe he's gonna die. And some people, they're not allowed to travel with airplane, or they have phobia or whatever. So I think it's very difficult for them.
Okay, I have another question for you, Dr. Yenny. What are the benefits for someone to leave United States as a great country? You know, we have so many great doctors in here. Especially, I've heard that the people who are working in India, they came here to study. So, what are the benefits for the people who want to go there in that hospital?
Okay, the first benefits is the 80% cheaper than here in there. And other Indian has a good, the same academic doctor like here, because so many doctors from here go to India and practicing there, and usually is staying there. So it's good for these two. Is the other benefits.
Okay, that hospital, is it for only tourism, or is it also for the people who live in the community?
No, it's for the community, for everyone to go there. No, it don't care if the people wherever place, like India or United States or from Colombia, Cuba, can go in there and get the benefits of the hospital.
So what money do people use to pay in that hospital?
Is Indian money.
So it means
It's,
if you have US, you have to change it from
no.
US to their money.
Usually they have a place that dollars can pay, so you can pay with dollars. It's easy for the people because you know the dollar is for around the world, so you know you don't change the money.
currency.
Yeah.
What do you think about that?
Well, in my opinion, people over here can get cheaper medication because we have Medicaid and free medication. So people who has no money or they're homeless can have free medication or procedure. So it's almost the same. You're not gonna save a lot of money when you go to India. Maybe you can it can cost more money because you're gonna need to travel over there. And otherwise, the hospitals in the U.S. is the best and really clean. They have good care, and also the nurses are well educated, so they take good care of the patients. So they need to take money of patients like in other countries. That's
Yeah,
it.
but I don't agree with you because the board also the United States made the hospital in there. So it's the same people, but it's cheap, 48% cheap. So I think it's better for the travel.
What about the education? I know everything is from the US to go all the way to India. So how is everything go?
Well, okay, you know that India has a good medicine, a natural medicine, and the medicine. So I think it's better because they have the recourse in there. So no need to travel their own medicine if they get the recourse in this country. That's what it is.
Oh, that's good. Okay, it was the News 9. We had Dr. Lee and Dr. Yenny.
Thank you.
Thank you.
Thank you.